Hi again, I am Dr. Alexander and today we will talk about Lyme disease. A classic presentation of disease during a patient-physician encounter looks like patient come with a rash on one hand or other part of the body and also a history of camping, hiking or anything related to forest. So let's go and review step by step everything related to Lyme disease. So it is caused by Borrelia. In US, type is Bordorferi. In Europe or Asia, it can be Garini or Afzeli. So Borrelia is a spirochete and represent a long, thin, spiral-shaped bacteria. It is transmitted by Ixodes scapularis. It's a tick, and high incidence in and highly rated incidence in US is appreciated mostly in northeastern part of the US, like Connecticut. There is a town called Lyme, and a high rate of incidence given even the name of the disease. So in the following slide you see a scheme of transmitting from reservoir like deer or rodents by tick to human. And if you are going to evaluate every stage, there are 3 stages, and the first one is localized stage. To develop a stage, it can take from 1 day to 1 month after tick bite. And there are 2 points to know: erythema migrans and flu-like symptoms like myalgias, arthralgias, fatigue, malaise, and some symptoms. So erythema migrans, it is called also bull's eye. It is red as a turgid, and it's a periphery, but between them there is pale or normal like skin appearance. And it even can serve as a diagnosis without an laboratory tests and confirmation if you see 2 things that I told you, like forest, anything related to forest like camping, trip or hiking, and a presentation of a classic rash. But important that it is not painful. It can be itching or burning in sensation, but not painful. Second stage is early disseminated. 2 important things you have to know are carditis and neurological signs. By carditis, you have to know that AV block and cardiomyopathy, usually first degree block. And neurological signs are Bell's palsy or affection of cranial nerve 7. Also other symptoms like rash, conjunctivitis, and muscular pain or lymphadenopathy. It can take weeks to months after bite for developing this stage. And late or chronic stage, it can take months to years after bite. And it can develop arthritis and peripheral neuropathy and encephalomyelitis. So how we diagnose Lyme disease? If we have a classic picture, there is no need of making additional tests. If not, or stage is advanced, there are many serological tests like IgM or IgEg, antibodies, ELISA or PCR. Tick attachment have to be more than 24 hours for developing disease. If it is less, there is no necessary of treatment. Also, if patient is asymptomatic, there is no need of treatment. If we are going for treatment section, there are important to know that for children and pregnant women represent a special patients. And if children less than 8 years old or pregnant woman, you cannot give doxycycline as or tetracycline, as this one is teratogenic for both. Like children will get discoloration of teeth, and pregnant may get some deformities or malformation of the future fetus. So we are giving amoxicillin or cephalosporins third generation for advanced disease, amoxicillin for first or early stage, localized. If adult or children more than 8 years old, we are giving a single dose of doxycycline or tetracycline. For serious symptoms, we are giving ceftriaxone IV if patients have carditis or neurological sign. And last thing to know is how to remove tick if it is found attached. But mostly people do not even feel that attachment or that bite, and can even not detect for many days. So don't squeeze him. Don't squeeze, don't push, or don't pull this tick. And how to do correctly the remove of the tick. So you have to grasp the tick with tweezers, a special one, and you are putting not tweezers on the body, but you are putting like close to the skin, as far from the body, and are like removing up, and that's all. And thank you very much for watching this video. If you like it, you can subscribe and follow. Have a great day.